All right, let's talk about something that can feel super complicated: heart medications. There are so many of them, right? Well, today we're going to cut through all that noise and make it simple. We're going to break down the most common meds so you can really understand what's going on.
Okay, let's just start with a quick question. What do you think is the single hardest working muscle in your entire body? No, it's not your legs after a long run. It's your heart. And it's not even close.
And really, the best way to think about your heart is as the engine of your body. I mean, it's this incredible machine that just runs and runs 24/7 from the day you're born. It never gets a vacation. So what's its core job? Well, it's actually pretty straightforward. It's just a big, powerful muscle that pumps blood. And that blood is packed with all the good stuff: oxygen, nutrients, and it sends it out through this huge highway system of arteries to every single cell in your body. It's basically the ultimate delivery service. Now, just like any engine, it can run into some problems. And for the heart, there are two main culprits we're going to focus on: high blood pressure, which you'll hear called hypertension, and high cholesterol, which leads to something that's basically like clogged pipes. Hypertension is, well, it's really sneaky. There's a reason it's earned the nickname the silent killer. It's because you typically don't feel anything at all. There are no big obvious warning signs until, unfortunately, a lot of damage has already been done. That's why getting it checked regularly is so important.
So when you get your blood pressure taken, what do those two numbers even mean? Well, the top number, the systolic, that's the amount of pressure when your heart is actively squeezing and contracting. And the bottom number, the diastolic, that's the pressure when your heart relaxes between beats. As you can see on the chart, a normal reading is below 120/80. Once you start getting above that, you're creeping into that elevated zone.
Okay, so what about that other problem, the clogged pipes? That's called atherosclerosis. And honestly, the best way to picture it is like a clogged drain in your sink. Over time, all this gunk, fatty deposits, cholesterol, what doctors call plaque, it just starts building up on the inside of your arteries. They get narrower, they get harder, and it makes it really tough for blood to flow through. And here's a quick but important clarification, because these two words sound almost identical. You might hear arteriosclerosis. That's kind of the general umbrella term for arteries getting hard and stiff, which can happen just from getting older. But atherosclerosis, with the athero, is that specific type of hardening that's caused by that nasty plaque buildup we were just talking about. So, if your blood pressure is too high, how do we fix it? Well, when it comes to the medications, there's actually a super simple little memory trick to help keep the main ones straight. I want you to remember the ABCD drug toolkit. A, B, C, D. Sounds simple enough, right? So let's break down what each of these letters actually stands for. A's for ACE inhibitors. Their job is to help your blood vessels relax and widen, which gives the blood more room to flow, and boom, your blood pressure goes down. And here's the easy trick to spot them. Their names almost always end in pril. Think lisinopril or ramipril. Next up, B is for beta blockers. These work a little differently. They basically tell your heart to just take it easy. They slow the heart rate down and reduce how hard it has to pump, which lowers its workload. And the giveaway for these, their names almost always end in olol, like metoprolol.
C stands for calcium channel blockers. These guys also work to relax and widen your blood vessels, similar to ACE inhibitors, but through a different mechanism. And yeah, you guessed it, there's a naming convention here too. For these, just look for names that end in dipene, like amlodipine.
And finally, D is for diuretics. Now, you've probably heard of these before. Most people call them water pills. And that's a perfect description. They help your body flush out extra salt and water, which means there's less total fluid in your bloodstream, and that brings your blood pressure down. Now, here is a super practical, real-world tip that's really good to know. Those ACE inhibitors we talked about first, the pril drugs, they have one really common, really annoying side effect: a persistent, dry, hacking cough. If that happens, doctors will often switch you to another class of drugs, called ARBs. They end in sartan. They work in a similar way, but without that annoying cough. Okay, so the ABCDs are a great start. But beyond that, there are a few other absolutely crucial safety tips that everyone should know when dealing with these kinds of medications.
This first one is a big one. It's about the blood thinner warfarin. Its effectiveness can be seriously thrown off by vitamin K, which is found in a lot of healthy leafy green vegetables like spinach and broccoli. Now, the goal isn't to stop eating these foods. Not at all. The key word is consistency. If you keep your intake about the same from day to day, your doctor can find the perfect warfarin dose that works for you.
Okay, everyone, listen to this one closely, because this is truly life-saving information. Nitroglycerin is a medication used for chest pain.
The rule is crystal clear. If you take one tablet for chest pain and 5 minutes go by and you feel no relief, you do not take a second one and wait. You call 911 immediately.
And finally, you have to be so careful about look-alike, sound-alike drugs. It's a real danger in pharmacies. Just look at this example. Quinine is for malaria. Quinidine is for a heart rhythm problem. They sound almost identical, but mixing them up could be disastrous. So always, always double-check your prescription.
Whew, okay. That was a lot of information, I know. So let's just take a second and boil it all down. What are the key things you really need to remember from all this?
First, just remember that your heart is your body's engine. Second, its two main enemies are too much pressure and plaque buildup. Third, don't forget your ABCs. That's your basic toolkit for high blood pressure meds. And fourth, and this is probably the most important thing, you have to be your own best advocate. Ask questions, know about side effects and interactions.
And that really brings us to our final thought for today. This knowledge is supposed to be empowering. So now that you know the basics, what's just one new question you feel you can ask your doctor or your pharmacist? Because being an active, informed participant in your own health, that is the most powerful thing of all. Thanks for tuning in.